Hello students, welcome to the class. I am Yogitha. Our subject is Psychiatric Nursing and today we are going to learn about a substance abuse disorder, substance use disorder. Now, before we learn anything about the disorder, let us understand some important terms here. This will be a basic class to understand all the other substance use disorders. What do you mean by substance? Now, any medicine, any drug, any item, what we use, and in which there is a much more potential reason, like chances to abuse that item, that material is called as substance. Now, what is use? Now, any substance you're using for the right purpose you're using, then that is called use of that substance. For example, now you're having cough, you're taking cough syrup. See, is the right use of that cough syrup. This is called use. What do you mean by abuse? Now, abuse means you are misusing the substance, then that is called abuse. Now, you're using this substance for a reason to get a pleasure, to get a tranquilized effect. This is what called abuse of that substance. Any medication, any drug, any material which you are completely depending on, that you are trying to use it for more and more reason where you get a pleasure. So this is called abuse of that drug, misuse of that substance. Dependence. Now, when you are using a drug and psychologically and physiologically your body is depending on that drug, you are like more tend to use of the drug repeatedly, then that is called dependent on any substance. We can see that alcohol dependence, or some patients are depending on some substances like opioids, cannabis. Then tolerance. What is tolerance? See, the example I'll tell you, the first time when you take any alcohol, maybe you may drink in very little quantity, but you get a maximum effect to your brain. But later it's become an addiction, habit to you. To get that maximum effect, that little quantity will not sufficient. You need to drink it in a maximum quantity. This is called tolerance. Now, tolerance means to get that effect, increased amount of dose, to get that decreased amount of pleasure, to get that first state, your body is depending. Your body has got that level of tolerating to that substance. This is called tolerance. Okay, so this is all about our substance use and abuse. Now, what are the diseases we can study under this substance use disorder? Or we can study a mental and behavioral disorder under psychotic substance use disorders. Now, mental and behavioral disorder due to use of alcohol. Mental and behavioral disorder due to use of opioids. Mental and behavioral disorder due to use of cannabis. Mental and behavioral disorder due to use of sedatives or hypnotics. Mental and behavioral disorder due to use of hallucinogens. So these are the main classification of disease what we can study further. Now, what is the etiology? Now, okay, before the etiology, let us know that what are the common drug what we are using. A common drug what we are using for abuse is alcohol, cannabis, hallucinogens, some inhalants, and you also maybe know that heroines, ganja, charas, LSD, some solvents to inhale and get that addiction. So these are all called as the various kind of substance what we use for addiction. Now, etiology, from where and how we are developing this substance use disorder. Maybe genetic theory says that maybe a family dysfunction. If maybe it has run in a family, it become a habit that in family one person will be their addiction to, definitely that will become a pattern for the rest of the generation. Or any psychological factors like you're having low self-esteem, no confidence, no motivation level, sense of inferiority. See, to cope up all these things, you're using alcohol or any substance so that you feel yes, fit. No. For the pleasure, to get the happiness. See, definitely we may say that yes, I got passed, I cleared my exams. Party. When party comes, definitely we'll think of this alcohol or any other substance. It doesn't mean that your party has to end with that. But it become a pattern, trend, tradition, style, peer pressure. And a psychological factors like when you feel lonely, when you feel low, when you feel sad, all the reasons we are depending on a substance. Okay. Then some social factors like you're from poor family, family like no love and affection in the family, broken families, you are the rejected child in the family, or urbanization, industrialization, or you belongs to such families where influence of these drugs are more, influence of these substances are more, criminal like influencers, or you are living in a slum areas. Okay, sometimes some religious practices. Maybe if you see traditional practices like any rituals, we are using alcohol, it is accepted. As a pattern of traditional ritual, we are using arachnet is accepted. See, because of this traditional practice, this become a habit for an individual. And one more thing, easily availability of a drug. See, when you get easily, definitely you tend to eat that. Okay, if you find it's a difficulty to get that, then you may not try that. But nowadays, drugs are easily available. Okay, now in academic reasons like your poor performance, you're not good at school, you don't have a confidence, you don't have a friends, inferiority, you wanted to shine in front of friends, or any or you have any physical deformities, to cope with that you're taking drugs. So these all factors influence a persons to take one or another substance. Okay. Now, what are the consequence of this substance? What we take? Definitely, when you take some substance, it will have some adverse effect on our life. Definitely, no doubt at all. I can give you an example. You see any film. There are so many films where they show that hero is having addiction of substance. Climax, definitely tragedy only. This tragedy, I mean, them hero may end up his life with committing suicide or something like that. We have not seen anyone who has alcohol dependent person, he's a drunkard and he had a great success. There is no such stories. So what's the consequence now? When the person is started to take alcohol, he will completely depend on the substance later on. Physically, psychologically, emotionally, he will be depending on that. So he feel that his life is unsteady, unstable without that substance. It will interfere his personal life. The person may not interested to the personal activities, no personal hygiene, no good relationship, no communication. It interferes with their family life, no good family system, no love and affection, definitely always fight, quarrel, arguments in the family. Occupation performance definitely will decline. Person is not able to pay the attention, no good performance at work. If in case you're pregnant, if the pregnant lady is consuming alcohol, definitely the fetus going to face the consequence, some malformation, abnormalities, definitely to the fetus. If you're taking alcohol, I mean any substance directly to the IV, intravenous, it has got a life threatening consequence. You may have to face a life threatening complications. Your food pattern is disturbed. A person who is taking substance, he is not eating proper food. He is not bothered about nutrition. So definitely he is facing a nutritional deficiency problem as well as a fluid imbalance problem. So many of problems will arise along with that. Insomnia also can develop. Person is not able to develop adequate sleep, not getting a sleep. See, insomnia. So these all are the consequence of this side effect, consequence of this substance. What do we take? Now, what all are the clinical feature you can see? When we see a client with the substance abuse, definitely we can see lot of clinical features like malaise, poor personal hygiene, poor attention, poor concentration, increased blood pressure, hypertension, palpitation, poor memory, no attention, no concentration. Many things we can see: agitation, psychomotor activities, hallucination, sometimes visually auditory hallucination. So this is the clinical feature symptoms what we can see with the patient when they are under influence of substance. So this class will be a base for all the other classes what you are going to learn now further. Maybe you're taking alcohol, opioid, cannabis. This will be the reason. This will be the etiology, clinical feature, and the symptoms, how the person is exhibiting his feature, and the consequence of this drug. I hope you understood. and please follow the rest videos, so where we are learning all the other substance use disorders. So when you hear this, definitely it will be a great help for you to understand the following classes. Thank you. Take care of yourself. I'll see you in next class with the following substance use disorders. Until then, take care of yourself. Time to say bye bye.